Welcome back, viewers. Today's topic is on cervix uteri cancer and the sixth part of the cancer series. Cervical cancer is the fourth most frequently diagnosed cancer and the fourth leading cause of cancer deaths in women, with an estimated 604,000 new cases and 342,000 deaths worldwide in 2020. Cervical cancer is the most commonly diagnosed cancer in 23 countries and is the leading cause of cancer deaths in 36 countries, with the vast majority of these countries found in Africa, South America, and Eastern Asia. The highest regional incidence and mortality is in Africa, with rates elevated in Eastern Africa. Human papilloma virus, short name HPV, is a necessary but not sufficient cause of cervical cancer, with 12 oncogenic types classified as Group 1 carcinogens by the International Agency for Research on Cancer monographs. Other important cofactors include some sexually transmittable infections like HIV and chlamydia trachomatis, smoking, a high number of childbirths, and a long-term use of oral contraceptives. The uterus or womb is where a baby grows when a woman is pregnant. The cervix is the lower part of the womb, also called the neck of the womb. It connects the birth canal to the upper part of the uterus. All women are at risk for cervical cancer. It occurs most often in women over the age of 30. Long-lasting infection with certain types of human papilloma virus is the main cause of cervical cancer. HPV is a common virus that is passed from one person to another. At least half of sexually active people will have HPV at some point in their lives, but few women will get cervical cancer. The cervix is covered with a layer of skin-like cells on its outer surface, called the ectocervix. Inside of the cervix, there are glandular cells that produce mucus. This is called the endocervix. The skin-like cells of the ectocervix can become cancerous, leading to a squamous cell cervical cancer. This is the most common type of cervical cancer. The glandular cells of the endocervix can also become cancerous, leading to an adenocarcinoma of the cervix. The area where cervical cells are most likely to become cancerous is called the transformation zone. It is the area just around the opening of the cervix that leads onto the endocervical canal. The endocervical canal is the narrow passageway that runs up from the cervix into the womb. Around 3,200 women are diagnosed with cervical cancer in the UK every year. That's nearly 9 cases diagnosed every day. Not everyone diagnosed with cervical cancer will have symptoms. That's why it's important to attend regular cervical screening. The most common symptoms of cervical cancer include bleeding other than menstrual cycle, discharge from the birth canal with unpleasant smell, pain in the pelvis area, that is between the hip bones, pain during sexual activity. These symptoms might be due to other conditions, and further investigation is required to diagnose the cause of these symptoms. A regular screening test is done in the USA and UK after the age of 25 to prevent the disease. If further assessment is required, patient is referred for some tests like colposcopy and biopsy. In biopsy, a small section or some cells are taken off the affected area to examine under a microscope, whereas colposcopy is a test done using a colposcope machine that has a big magnifying glass to physically spot any changes in the cell. The treatment depends on exact location of the cancer, whether it has spread to the other parts of the body, the types of cancer cells, and the condition of the patient, which treatment is suitable for them. The type of surgery in which womb and cervix is removed is called hysterectomy. There are 4 types of hysterectomies. In total hysterectomy, the womb and cervix, neck of the womb, are removed. This is most commonly performed operation. In subtotal hysterectomy, the main body of the womb is removed, leaving the cervix in place. In total hysterectomy with bilateral salpingo-oophorectomy, the womb, cervix, fallopian tubes and ovaries are removed. In radical hysterectomy, the womb and surrounding tissues are removed, including the fallopian tubes, part of the birth canal, ovaries, lymph glands and fatty tissues are removed. It depends upon the spread of the cancer which hysterectomy to perform on the patient to save other organs from the cancer spread. For advanced stages of cervical cancer, that is called metastasis, in which cancer spreads to other parts of the body. Chemotherapy, radiotherapy and target drugs, or a combination of 2 or 3 is used, depends upon stage of cancer and patient's general health. A person's risk of developing cancer depends on many factors, including age, genetics, and exposure to risk factors, including some potentially avoidable lifestyle factors. 99.8% of cervical cancer cases in the UK are preventable, as these are caused by the HPV infection, whereas 21% of cervical cancer cases in the UK are caused by smoking, and these can be prevented by quitting smoking. Statistically, 53% of patients have surgery to remove the tumor, 40% have radiotherapy, and 33% have chemotherapy. Cervical cancer risk is almost 3 times higher in women who have had 6 or more sexual partners, compared with those who have had only 1. Cervical cancer risk is around doubled in women who became sexually active age 14 or younger. The risk is reduced in women getting cervical cancer if they have their only current male sexual partner is circumcised, compared with those whose partner is uncircumcised. HIV or AIDS increases the risk of getting the disease 6 times. Oral contraceptives increase the risk by 10%. Family history increases the chances of getting the disease too. If someone's mother, sister or daughter is diagnosed with cervical cancer, the risk increases 70 to 80%. Unfortunately, 2 women in the UK and 12 women in the US lose their life due to cervical cancer every day. So it is important to take part in the screening program and see your GP if you experience any of the symptoms for further diagnosis. This concludes the 6th part of the cancer series. I recommend you to watch rest of the episodes on this series, which covers the history of cancer, chemicals responsible in cancer development, and most common types of cancer globally. If you found this video informative, you can share with your family and friends and subscribe to this channel for more informative content. Thanks for watching.